up.
Unjar me.
Unjar ya.
Take me out of the jar.
Take you out of there. So there's plenty of stuff you can do. Work into the thumb. You know, if you've had carpal tunnels and it's been like that for years, you've lost the true the sensitivity in your fingertips, and you don't know what a normal feeling is like. So even just getting some blood flow in there for your patient is going to feel really good. G'day guys, Darcy Ninja here, back for another YouTube episode. Today we're talking carpal tunnel and how we're going to debunk the thought of having to go in for surgery or having things like cortisone and stuff like that. Because we see a lot of people that have come into here and they've had the surgery and it's not successful. And we thought there's ways that we can treat it that's actually going to be more effective, okay? So first of all, we need to understand what it is and how we can diagnose it. So it's basically, there's a carpal tunnel in our hand, right? So there's a tunnel that's like through this section of our hand that actually creates space between the bones for our median nerve to run through and help us move our fingers, right? So our median nerve will only affect our thumb and these three fingers, 1, 2, 3, and a little bit of this one, okay? So if you've got numbness, tingling, or loss of dexterity or weakness in that hand, that's usually how we diagnose carpal tunnel. We see it in clients or patients that are, it's an overuse and repetition. So it's drivers, it's people on a mouse all day, it's people lifting heavy weights and that sort of thing. And we see it probably more in elderly than the young. But I want to show you guys today how we can treat it, how we can basically unravel and decompress that median nerve in this space here with our Bodywork and effectively treat and eradicate some of your pain. So what I'm going to do, using Ninja's hand, you don't have any carpal tunnel, Ninja? Have you ever had it before? No, because us therapists, we're always using our hands too. So maybe there's some therapists out there that might have some carpal tunnel syndrome as well that need to understand how they can fix it.
Sorry for interrupting your video, guys, but I want to talk to you about the MMT Online Academy. So you might have been looking at Ninja and I doing our stuff for a long time now, thinking, how good would it be to work at MMT? But you might be overseas. This is your chance to get exclusive content, updates from us every single day to make you a better practitioner, more new customers, better results, and skyrocket your income. So if you want to be on the inner sanctum, get into the Academy. All you got to do is dedicate 5 minutes a day to making yourself better, and it's just $28 per month. How good's that? $7 a week. Let's go!
What I'm going to do is a bit of a palm on palm to begin with, so just to get some blood flow and circulation. What we want to do is be able to open up that space in that area, but to begin with I'm just going to get some connection straight on Ninja's hand and palm, and just I'm pushing forceful. My force is pushing straight down, a little bit of a direction up towards his elbow, just to unravel some of those superficial layers and the build up that we get on in the hand. And it also feels really good as us therapists are constantly using our hands just to get some blood flow and movement through here. I guess another misguided conception of carpal tunnel can sometimes be is that you need to stop doing what you were already doing and completely change your job or that sort of thing. And yes, there are setups where we can encourage better ergonomic setups with your desk if it's happening with a desk, or driving and that sort of stuff, or putting on a splint. I don't believe those things are effective either. The most effective thing that you're going to find is actually just getting in here and getting some treatment, creating that space, doing our day surgeries. So getting in here and opening up the space. I was actually just watching what they do surgically, and it's quite interesting. They basically just put like a little plastic stint in there and create space for the nerve to run through, because that nerve is getting compressed and aggravated, causing that numbness and tingling. What we're going to do is just create space in there and find that exact point and clear it and clean it out. Pretty much like the sciatica video that I did with Ninja. We might be able to put that in the link, but we're looking for the adhesion or the sticky point in the tendon or the ligament or the tissue that is compressing on that median nerve. We're finding that and then we're unraveling it, because it's just calcified build-up or really sticky tissue that's causing that numbness. So treatment in the flexors, so these are our flexors in our forearm, are going to help to decompress that and just get some length in that tissue. How's that feel?
Yeah, it feels like a really good stroke, man.
Yeah. It's really broad, getting a good palpation. I can feel already that up here Ninja's got some tension. So we can just start to work a little bit higher. This isn't exactly like carpal tunnel stuff, but sometimes we misdiagnosed carpal tunnel for really tight forearms. We've got tingling in our hands and fingertips, or a weakness in our wrists from really tight forearms. And what's interesting about our forearms and the muscles in here is a lot of them attach midway into the radius and into the ulna, and even in between the radius and the ulna. So they've got muscles in between that, got some that cross over our supinators and things like that. So as long as we're working to that depth of the bone, we're actually going to be working into the tendons and the attachment sites of these tissues, which is sticking to our philosophies, making sure we go into the tendons and create some space in there. So I just liked that there was a really tight spot in here on Ninja, and I like to work it out. What's also cool is Ninja's just sitting up in his chair. He's pretty comfortable. We've got full, my body's not been impacted too much. I'm not trying to like lean over and get into really awkward spots, because as a therapist, you've got to look after yourself and you've got to look after your client as well. So up there, but okay, so the main point that we're going to work on, where they actually make an incision, is right in here. So right on that spot there. So I'm going to start in the thalamus, start in that tissue there, and then I'm going to slowly come in and hit that point right there. This is where surgically they'll make an incision and try and open up that space. As I said, you really don't need to do surgery. Let's just pin that tissue, unravel it, allow that nerve to run through freely there and do its job without the interference of really tight muscles or muscles that are sticky to that nerve compressing on it. So how does that feel there, man? Does that feel good?
Yeah.
Yeah. It's a nice little money spot in that area there. We've got really thick layers of fascia and connective tissue in this area as well. So it's nice to just sink into that and try and melt it out and soften what's rigid, make it more supple and soft. So not a lot of movement, just working to the depths that we feel is necessary and clearing that away. So I'm going to go into that there again, open up that palm and hand and work straight down into it with a thumb. I can use an elbow. You guys can use a massage ball. You can ask your partner to try and get in there. Just go deep, go slow, pin and hold spots that you feel, resonate with the client or person with the symptoms.
Whoa,
In there's good.
Yeah.
And use that intelligent information, that feedback, that's the spot. They're the master. Ninja knows more than I do where the right spots are, because he can feel it. Yeah, and you can feel like little crackly spots, maybe like little calcified spurs that have been stuck on that bone that we can sort of file away and move and create space.
Thumb treatment as well, mate.
Thumb treatment, man. It's so nice.
Yeah.
Lots of little bones that sometimes get, like if your hand's like this, what are the bones going to look like? You know, if you're holding onto a mouse like that for 6, 7, 8, 9 hours, that's like having that's the same as your foot, like putting your foot in a shoe and compressing it and jamming it. We need to open that up, create space and blood flow. So even if we just like opened up the bones and started to, you know, open the hand up a little bit, spread it like that sort of thing, that's going to help it as well. So I guess, yeah, it's compressing like that, and it's our flexors that are really tight like this as well. So now we're going to work the actual wrist. So that space in between, the wrinkles will guide you where to go. You don't want to go super deep, because we do have, you can actually see those veins and things. They are quite superficial in that area, so it's a delicate area. You don't want to aggravate it or hurt your mate. So just as long as you go slow into that and weight with weight, and feel that you're doing good work. Yeah, that's nice in there. Just take a seat. I'm gonna
Go to the edge.
Yeah, look at that. That's brilliant. I can like open that up even more and do some dynamic treatment, really stretch that nerve. Somebody with carpal tunnel, they're probably constantly shaking their hands out and trying to stretch it just naturally, because that's effectively what, that's what they're going to feel is somewhat going to give them some relief. Ninja's got really good wrist range of movement actually, which is good. Okay, and we're also going to feel, in here we have those retinaculum that it's like having tape around your wrist that keeps our wrist nice and strong. We're going to affect that as well, as that can be something that's making that space. If that wrist is cylinder, it can be squeezing it, yeah. And these are just pipes in our body that we just need to get in there and plumb it out, clean it out properly, get rid of the first few layers and clean out the deeper layers, the build up. So just think of these keywords. Melting is a really good thing to feel and understand. You're trying to soften what's really tough. Soften that up like butter. And effectively just trying to make some space in there. Work all the different angles. So naturally I've just started to go more towards the thumb. I can feel like there's some spots in there. How's it feel for you, man?
Yeah, it's good, man. Just to have the wrist mobilised too. Really feel like it's interesting to look at all the anatomy down here too, like all the, like Darcy was saying, the retinaculums, the taping around, and just the bones all in the wrist, but all the different muscles that kind of originate up in the forearm and then end up going down into the palm and into the fingers. So we did one on the foot, didn't we?
Yeah.
We were going to do one on the hand, I think.
Just happened naturally, didn't it? With subconscious or unconscious, whatever it is,
Yeah, so what is it, palmaris?
Palmaris, yep.
Palmaris, yeah. Has everyone got one of them?
I think so.
Yeah,
I don't know.
One of these muscles down here, not everyone there. We have to go back to that and have a look.
You go back to there. I'm going to show you how I can use an elbow, Leo, because I reckon this is gold. I love getting an elbow. The real point of it, because a lot of people out there don't have the strength, and just pin that.
And I can grab him a bit more.
Yeah, and pull me in there. I can get more of my body weight onto it.
Whoa.
And I reckon that's a really nice money spot to just play around with. And you're not going to damage somebody by putting an elbow in there if you're following these philosophies of just like sinking in, not really aggravating it by moving too fast or coming in too hard and bruising.
You're not going to damage things.
No.
It's going slow, allows the body time to receive it, accept it, and then it can respond by melting. That's what we want. We want that melting to happen so the healing can happen.
Yeah. Yeah, it just depends how chronic the issue is as well, you know. I always use the expression of a hard lolly or a hard minty. If the minty's been in the fridge and it's stuck and it's really firm, you're pushing on it with the thumb, like, your thumb's probably going to give up before the minty does. But if I had a big, giant minty that was super hard, how would I melt that and make space in there? And if I pushed on it, would it have this concave shape to it afterwards? Essentially, that's what we're doing in here, and that's going to allow space and movement once we start to open this up.
Imagine a lolly's stuck to a cement floor or something like that.
Yeah, and you've got to clean it out.
Clean it up. You want to melt it. All right, if you kind of just try and bash it and chip it, you could damage the cement, the flooring. You take a big chip out, or if it's really stuck. But if you wanted to get it off nice, and so you don't damage things, you've got to melt it and work it, haven't you? So,
You don't want to ruin the new polished concrete.
Yeah.
Oh.
So treatment, hands-on treatment is a heat treatment. So all kind of, whether it's chiro, manual therapy, osteo, physio, all that kind of, or exercise rehab, it's a heat treatment. Because you're getting movement into the body, you want things to flow. mobilise where they kind of were stuck and stagnant. So we're trying to create that flow so healing can occur, but we don't want to damage and traumatise things further. That's the last thing we want to do. We want to actually get things to heal. So it's important that we go nice and slow and just respect wherever that tissue's at and where the person's at, if they're kind of willing to kind of endure the sensations that go along with the cleaning of the body. In there, it's good, man.
I just feel like I want to create some separation in here. Yeah. If you've had a foot injury where you've fallen on an outstretched hand and you've jammed it and jarred it, think of how you could jam this wrist and how we can open that up, like the tissues in there. Sometimes it can be something that happened in your earlier years in life, an injury where you've fallen off a scooter or had an incident playing frisbee in the park, or the dog's pulled you over and your wrist has been jarred from it. We want to unjar it. Is that a word, Ninja?
Yeah, it is, mate.
Great.
In my bloody dictionary.
Yeah, beautiful. Open it up.
Unjar me.
Unjar ya.
Take me out of the jar.
Take you out of there.
That's it.
That's it. Fucking hell. It's cool. All right. So there's plenty of stuff you can do. Work into the thumb. Even if you come back a bit, Ninja, and give me some space. If you are getting, if you've had carpal tunnels and it's been like that for years, you've lost the true the sensitivity in your fingertips, and you don't know what a normal feeling is like. So even just getting some blood flow in there for your patient is going to feel really good. So push it towards the thumb, towards the pinky, or push it down towards the hand. You can work the tissues in the fingertips as well. And as I said, that median nerve is going to affect these first three and potentially half of this one. Ulnar nerve is more out this way, and then our radial nerve's on top of the thumb. So just a little bit of DK's anatomy for you. So just getting in between all the little grooves and spaces. Hardly any wax, just enough to give me some purchase and then glide and move through it without sliding over the top. I'm doing that. Cool. And we'll finish off with a bit of thumb work there as well. So if you're pumping medication and you're taking anti-inflammatories or painkillers, you're wearing a wrist guard, you're booked in for a cortisone, I want you to at least try this first. At the very least, go and see a therapist, come in and see one of us at MMT, get your partner to do this on you, get a purple massage ball and start to push that on a hard surface, push it into the hand like this and get some relief in there. Do it yourself and release up the forearms and work all these tendons and ligaments. But otherwise, yeah, don't go straight to your GP and get on the meds. It's not the right thing to do. Do the natural thing, get the blood flow in there. Do some self-treatment like Ninja's doing there with an elbow.
Your own thumb, elbow down through there.
Yep.
Yeah, it's pretty easy to do as well.
Yeah, and it feels really good. Attempt it on yourself now if you have carpal tunnel or not. Getting the thumbs and wrists and hands feeling nice and full with blood and getting that circulation in there. Yeah, look at that. Different angles and things that you can do as well.
Yeah, while you're engaging there.
Yep.
Right.
Yeah, essentially we're just telling you to have a crack, give it a go, see what you can do. Otherwise, book in with one of our practitioners here at MMT. We've got clinics in Richmond and Ferntree Gully. We've got Fix It Yourself content out there as well on the wrist. So there's stuff you can buy for under $30 that you can follow along and learn how to fix your own body as well. So make sure you like and subscribe, comment below what you thought of the video. We'll be back soon for another one.
Yeah, done.